The last several days have been a celebration of the experience, success, and innovative spirit that make VHA the leader in healthcare innovation. Each and every one of you should be proud of the work you do to make VHA a stronger, more effective, and more equitable provider of healthcare to our nation's veterans. And celebrate you we will. To close IEX, we're going to celebrate the accomplishments, potential, and drive of our colleagues across VHA. I now have the pleasure of introducing back to the stage Allison Armheim, Director of VHA Innovators Network, to launch the awards ceremony. Join me in welcoming Allison.
Thank you, sir.
You're welcome.
Hi, welcome back, welcome again. It's afternoon, I've lost my mind, I'm very tired. Okay, so let me tell you a little bit about the Innovators Network if you missed us before. Call ourselves INET, and we are a group of 36 VA medical centers throughout the country who invest and concentrate on employee-driven, veteran-focused innovation. I like to call us VHA's Innovation Revolutionary Squad. INET supports both the design and development of employee-generated solutions and also the education of thousands of employees through teaching innovation competencies like building innovation strategy, human-centered design, storytelling, lean startup, and a lot more. So before I jump into these 3 awards and these 3 amazing people, if you have participated in our programs, our educational opportunities, so our teaching, if you participated in SparkSeed Spread, I want you to stand up. So it should be a very high number of people. So give them a hand, first and foremost. So it starts in INET, right? It starts on the front line. So these people are the ones doing the work, putting in the work. So I'm excited to present 3 awards, the annual INET Awards, to some very special individuals who have really excelled in this work. First up, we have the 2022 Tanked Award. The Tanked Award celebrates the idea of agile innovation, the ability to pivot, and also incredible dedication to solving a problem, no matter how many obstacles arise. And I am thrilled to announce Stacy Garcia as the 2022 Tanked Awardee. So Stacy Garcia and her partner, Alice Allen, embrace the spirit of innovation and iteration completely, coming into the program with a mandate from Outpatient Mental Health Shared Governance Committee to push a preordained solution. So they came in like anti what we were really about, right? We want to lead the problem to the solution, not a preordained solution. And Stacy and Alice actively participated in SparkSeed Spread Accelerator program. They did all their homework. They had a million struggles. They carved out their own path. They talked to a lot of veterans, like a lot. And their reward was learning that the solution they were tasked to push out wasn't going to work. It wasn't going to solve the problem. And so after several pivots, some very low fidelity prototypes, they landed on one that was able to demonstrate efficiency. So the Tanked Award does not signify a failure, but the ability to pivot and the flexibility of the investee. Stacy went through the process of innovation, and sometimes that means the solution isn't what you thought it would be. However, Stacy found the solution that was right for veterans, and she embodies the fact that it's not about the solution or result you want, but putting in the work to find the solution that your audience needs. Stacy's ability to do this shows her tremendous strength of character.
On behalf of myself and Alice Allen, we are greatly humbled and honored of receiving this year's 2022 Tank Award. When we began this journey 4 years ago, our goal was to prevent a mental health crisis from turning into a situation where either the veteran or someone else is harmed. I'm proud to say that with the imminent production of Help is Only a Phone Call Away reference magnets, veterans will have an additional resource to access the mental health care they need at critical times. It means a lot to be recognized for our perseverance because we see it modeled every day from the veterans and our colleagues here at Greater Los Angeles. I'm excited to continue along this journey and appreciate the support from the Innovator Network SparkSeed Spread program, along with Dr. Braverman and my colleagues here at GLA. We thank you very much.
So next we have the Investee of the Year Award, and I am so pleased to announce that Kevin Johnson from the Cincinnati VA is the recipient of this award, and he's actually here, so stand on up, Kevin. You're not getting out of this. This is a very, very deserving recognition for an awesome advocate and innovator for veterans. The Investee of the Year is nominated by their innovation specialist and then selected by yours truly. Kevin has persevered through more barriers than one investee should have to encounter. He's continued to grow, learn, and follow through despite continuous upward battles. He is receptive to constructive feedback and makes the necessary changes to iterate his solution. He appreciates the process of innovation and the work it takes to get something done right. He is also extremely passionate and dedicated to his work. Kevin regularly meets with stakeholders in off hours, before or after his normal tour of duty, and does so with no reservations. He has truly demonstrated what passion for innovation looks like. And his attitude and participation in the Accelerator series is also very much appreciated. He juggles everything with apparent ease, at least from outside eyes. Kevin's device was one of 13 to be featured at our first ever VA Entrepreneurial Product Marketplace Day just yesterday. And I have absolutely zero doubt that Kevin's device, the Kyphotic Wedge, will be used throughout VA upcoming years and licensed for external use. And nothing in the whole world would make me prouder than my kid winning this award in 20 years. So come on, Kevin. Let's give it up for Kevin.
Hello, my name is Kevin Johnson, and I am the 2022 Investee of the Year for the Kyphotic Wedge. What started with just a Barbie doll and a piece of wood has now blossomed into a fully functional device that can tilt the patient backwards and sit them up. Now, this could not have been possible without a lot of help from very, very kind and generous people. So I want to thank Lindsay Rigler, who is my innovation specialist, Allison Amerheim, who I just butchered her last name, I'm sure of that. I want to thank Stefan Susta with the Tech Transfer Program, all the men and women up at the Minnesota VA MAID Department, Colin Knowles and Gregory Voss, and especially my supervisors, Lorinda Shaw, Alyssa Ladd, and Dr. K, for giving me the opportunity to work on this project. And I also want to thank Jane Johnson, who is either the most happiest person in the entire world, or she just really loves the Kyphotic Wedge, because she is very ecstatic about it. So once again, thank you very much. This could not have happened without the help of all those people I mentioned, and I cannot wait to see how this project ends. We're getting really close to seeing the finished product.
Lifting help, please.
No! Use the Kyphotic Wedge!
Thank you, Kevin. Congratulations. Thank you, sir. And last, but certainly not least, I am pleased to announce the 2022 Innovation Specialist of the Year. Nothing would happen, no Innovators Network, no my job, no anyone's job without Innovation Specialists. I am so grateful for this team, I cannot even tell you. These are highly trained leaders of innovation programs at the facilities that encompass INET. Backed with INET training resources, innovation specialists are equipped to understand the on-the-ground challenges and meet them with innovative approaches from the front line and aid frontline employees to develop their solutions. The 2022 Innovation Specialist of the Year is Orlando VA's Innovation Specialist, the one and only Kim Balicki. So this is as you can tell by her fan club, a most deserving recognition for a remarkable individual. Innovation Specialist of the Year finalists are chosen by me, but the selection is made by their peers. As many would agree, Kim is the heart of VA Orlando and the heart of INET. She is not only a leader of her local community, but a trusted leader within our INET community. Her creative and exhaustively positive approach have not only helped Orlando's program, I'm telling you, go visit down there, she will run you ragged, but it supports and allows innovation to thrive throughout Vision 8. She is a tremendous asset for Greenhouse Initiative projects, and if you don't know what those are, ask me later. So from Orlando, Vision 8, SimLearn, she brings them all together to collaborate. Her willingness to lead and build bridges is enormously valuable. No one has more energy or is more passionate about what they do. It is an honor to call her a colleague, a teammate, and a friend.
Hi, everybody. This is Tim Cook, the Medical Center Director and CEO at the Orlando VA Healthcare System. And today we have a very, very special opportunity to honor somebody who has gone way above and beyond, explored the stratosphere of innovation, and has done so for her entire career and brought that special, very special nature to here to Orlando. So today I have the very great pleasure of introducing Ms. Kim Balicki, and she is, drum roll, the Innovation Specialist of the Year. How about that? Thank you so much. Kim, how do you feel?
Thank you so much, Mr. Cook. I am absolutely honored to be selected by my peers in INET as Innovation Specialist of the Year, and I thank Mr. Cook and his leadership for telling me sky is the limit. Don't set boundaries, just keep growing, and that's really what we've been able to do here in Orlando. And I also thank the INET leadership, support of Allison for her guidance, and a huge thank you to my innovation tribe, the innovators and the veterans. They are what make me do my job with success because they have such passion and are such change makers. So let's innovate on.
And that's not all. Unfortunately, we do not have an immediate presentation, but it just so happens that I have this nice shark to join me. So, Kim, on behalf of the Orlando VA Healthcare System and the entire VA system, I would like to present you with Sharky.
Thank you very much. And this shows that Mr. Cook is very engaged in our yearly pitches. We have them twice a year that innovators get to pitch to leadership and get an investment.
Well, that's what it's all about. We invest, we see, we grow, and great things happen. Thank you all very much, and congratulations again, Kim, on your absolutely remarkable award. Well done.
Thank you.
So Kim gets a different trophy. It actually has a beautiful unicorn on it, and I sent it to VA Orlando, and it just didn't quite make it in time for the video, but she has it now. So I am so proud and thrilled for each of these individuals, and thank my entire team, thank the support team that supports us through everything, and I am personally and professionally inspired by you all. Thank you so much. We're going to watch a quick video, and then Dr. Ryan Vega will be back with the rest of the awards. Thank you all. My heartbeat.
Well, good afternoon. It's a pleasure to be here with you today, and it's been so wonderful to see and hear about the innovative advancements happening at the VHA. some of which have been presented over the last couple of days. My name is Janice Jesse, and I had the honor and good fortune of being married to Bob Jesse for over 40 years. I was so lucky to have a front row seat to see how his fascinating and brilliant mind saw things in a big picture and visionary light. I know firsthand how much care and dedication he put into improving the care across all of the VA healthcare system throughout his 30-year career with the VA. After Bob's passing in 2017, we established a nonprofit organization in his honor, the Jesse Family Foundation, where we strive to carry on his legacy by adhering to his key values as a family man, friend, physician, colleague, and mentor. Our goal at the JFF is to empower today's healthcare visionaries to push the medical boundaries of tomorrow, which aligns so well with this award. To see the Robert L. Jesse Award for Excellence in Innovation, established by the VA in Bob's name, means so much to me and my family. Knowing that his legacy continues to inspire others is a tribute to his memory and one that would make him proud. I'd like to offer a huge thank you to all who dedicate your work towards a brighter future, and a hearty congratulations to all of the finalists for this award. So continue to dream big, be creative, and embrace the spirit of innovation. Thank you.
Allison, where are you? Did she leave? Really? You got to be kidding me. Well, I'm going to say a few words about Allison, both her growth as an individual and as a leader has been quite profound. There is not a day that goes by that Allison doesn't call one of us and say, I've got this idea, I don't think it's going to work, but what if it did? And a lot of them have. So I value both what I've learned from her and her commitment not only to the mission, but to continuously investing in you all is both something that I will carry on. So Allison, thank you. And to all the folks from INET, there she is. We were talking about how terrible of a job you've done. Unfortunately, we're going to have to remove you. No, we were singing your praises a little bit. And then to the innovation specialist, Kim, look, you heard from the undersecretary this morning. You all, both in your courageousness in coming to the VA, because I've said this for years, you all drive by a lot of hospitals that are much easier to work at. That's a fact. But you all come, and you all do things that are just profound in their impact. And you do them with almost no resources in environment and cultures that can be quite challenging. So if you think of where we are today and how all of this has come together, it started with an idea and an investment in the Innovators Network and an idea that if we took that work and diffused it, we would be a better organization. These poor folks are not going to like me because I do not follow teleprompters. But and then I'll make a quick comment about Bob Jesse. I met Bob when I was a resident. He was seeing patients still at the Richmond VA Medical Center as a cardiologist. Now, at this time, he had been the undersecretary. He did all different types of things. So somebody said, you should go talk to Dr. Jesse and ask him about career advice. First time I met him, he's sitting in clinic writing notes. He and I are chit-chatting, and to make a long story short, his advice was very simple. He said, you're in healthcare for a reason. do one thing and you will continuously find joy and value. Care for people. Don't provide health care. Don't go into administrative work because you want a title. Figure out a way to care for human beings, and you will always find joy and value. And he was right. And I couldn't think of a better individual for the Innovation Award to be named after than someone that instilled that spirit and that level of humbleness in each of us. And with that, and somewhat unceremoniously, we will move into acknowledging and recognizing you all, the reason that we're here. Now, another thing that makes this moment somewhat sentimental for me is that we haven't had this in a couple of years. So the fact that we're talking to people instead of cameras is actually quite nice. You all can give me feedback and actually laugh at terrible jokes. The camera just stares at you. So we never had a chance to award our COVID-19 Maker winners. These were individuals who stepped up during the pandemic and who did amazing things, developed amazing solutions and products that got into the hands of our clinicians and our veterans and saved lives. And so we did not want to recognize those individuals virtually. And so I am incredibly grateful that we have an opportunity to finally recognize those individuals. Our first winners, who are not here, unfortunately, was Team Symptom Check 2. Alok Desai, Hazel Mann, and Natasha Bach. Their solution aimed to tackle the issue of testing workers and visitors as they enter into nursing homes each day. If you all remember, some of the first wave of the pandemic took nursing homes down very, very quickly, including at VA centers. And so their ability to help us check these providers using mobile symptom checkers and thermobiosensing kiosks enabled us to get providers into nursing homes. Those were state nursing homes, our nursing homes, or community nursing homes. And so for them, we are internally grateful, and congratulations if they're watching. Our second team was also not able to be here, but we do want to recognize them. Team Happy Face, Hunter Futo, Brian Patterson, Eric Meyer, Shiomo Heifetz, and Yona Clonin. This team designed comfortable 3D printed masks. In fact, I actually wore one of these on the wards that allowed for first responders to easily customize their appearance and their fit. They did extensive user testing, and they worked with emergency personnel, fire, EMS, clinicians on the front lines. After wearing an N95 all day for 3 days in a row, I can tell you these things were a game changer. So to them, wherever they are, hopefully they're watching, thank you for the work that you all did, and we appreciate it. Our third winner team is here. So this is Team Tessellation Sanitation Station. So Kevin, I see you over there. If you and your team are here, would you all mind coming up? So Kevin Patel, Darren Schwenke, Thune Sandi, Brad Jennings, Luke Androsky, Dan Edelman, and John Gorman were the whole part of this team that designed a solution that uses concentrated UVC lighting to create a station capable of sanitizing objects in just seconds. In essence, the way this was explained to me, because I don't understand any of what I just read, was that they created a box, and somehow this box could make something sterile out in the field. Now you can imagine first responders, some of the triage tents that were being stood up, field-based hospitals that were being stood up in the early days of COVID, the ability to have this type of equipment easily and accessible and to know that it worked makes a huge difference on our ability to provide care. And so they worked with teammates at the North Texas VA Health System on the prototype. They engaged INET and the Greenhouse Initiative, and their solution is actually now widely used in VAs across the country. We actually use this to clean our virtual reality headsets for veterans between sessions. So to Kevin and to your team, I really appreciate it, and I'm glad you're here as well. We have a little something for you, and thank you all for your work. I got a hug. Oh, sure. I'll let you all both hold it. You can sanitize it after. We have We'll pretend like that's taking a picture, okay? So smile for a second. Good. All right, one last round of applause. Thank you both. And then our fourth winner. Victor, are you here? Come on up, Victor. So now that I've gotten to know Kevin more, unshockingly, he was also part of this team, along with Thomas Stillwell, Darren Schwenke, Stephen Handler, Stormy Thomas, Brad Jennings, Luke Androsky, Cody Andrews, Samira Dehababi, Victor Perez, and Thune as well. You're part of this team too. Yeah. Kevin doesn't talk about you, I'm sorry. So their solution was a Wi-Fi and LTE-enabled testing case that would accommodate PPE, telehealth equipment, and testing equipment for home visits and for field testing equipment. Through the VHA Innovators Network, the team received $10,000 investment in funding to further validate their solution and have actually, if I'm not mistaken, now brought this into further production.
Yeah, with Connected Care.
Yeah. So big round of applause for you all. Just amazing to see your work and glad that you could join us and he doesn't get all the limelight. There we go. We got a real camera now.
Come on, guys. Come on, get in here. We did good work. Dude, COVID was hard. Act like it.
Thanks, team. And last but certainly not least, and oh, wow, shocking, they're on this team as well. So Thune, Darren Schwenke, Kevin, Stephen Carr, Ray Williams, Maria Burignano, James Hogart, Jabe Mercado, Jerron Rogers, Kevin Cox, Abigail Brown, Mike Pasalaquanta, Victor Perez, and Jackie Gill. This one, I think, means a lot, not only to me, just because of the challenges we faced in the hospital in the early days of getting ventilators, but this one unquestionably saved lives. The team designed the Pandemic 800 ventilator for use in disaster relief scenarios. It's actually an open source ventilator built using highly accommodating hardware, has a novel low-cost sensor package, and then used 3D printed parts. It includes all the basic features of a ventilator in addition to being centralized monitoring station, and then they also built in resuscitation automated assistance breathing mode in the case that the patient was in cardiac arrest or not breathing. I think that one we can all agree saved lives. And so to commend you all and you all again, appreciate what you do and round of applause.
Can I talk for the VA of Dallas, Texas?
Yep.
I wanted to, myself, my name is Tim Sanadi. I work for the VA Dallas as an ICU nurse. Sorry? No Dallas. Yeah, right. And during the COVID-19, I was, of course, in the front line with all the COVID patients. Many of us were scared to death, and when I heard about this COVID opportunity to bring some innovation and helping the front line, I jumped in. And of course, I asked Kevin, and he was like, oh yeah, all in. So when all in, we did like
that was the whole conversation.
Yes,
right there.
it was like 4 weeks, 4 weeks of finding innovation, helping the frontline maker. And the VA Dallas, I just wanted to say thank you for all the management support we got, because for example, for the sanitation station, we put it in test. So we asked our infection disease control manager, Sherry Reed, to test it, and we did it. We bring this big box, and Kevin put his flip-flop on it, and we sanitize the whole thing, and
I think they almost called the bomb squad.
Yeah, right.
If Caitlin's here, I think she set off a fire alarm somewhere in her office.
So we sanitize his flip-flop, and we use
That's the baseline
yeah,
for sanitation.
Right, exactly. And we use the RNA tester, and it really supported all the evidence-based proof using UVC. And when I brought this technology to the VA Dallas, few weeks later, we even brought by some robot to sanitize all our COVID patients' rooms. So we definitely improve the patient care, and we really, during this pandemic things, which was scary. And for the telecase, we were able to gather at Dallas the community, like Dallas Makers. We had some veterans participating in it. Victor himself is a veteran, and we had brought also some artists in that area. So really, since the beginning, we all said it's a teamwork. It's really a teamwork, and bringing all these people together in 1 week and coming with a telecase, I think it was really special. And I wanted to thank also Stephen Handler, because he was really the head of this project. Yeah, and for the last project, the ventilator. And yeah, like Dr. Vega saying, it means something. Like MIT did a ventilator, and we did a ventilator. And this ventilator, it works. Like, we took, we couldn't do on a real human life because we didn't get yet the FDA approval, but we brought it to the Dallas VA Medical Center Biomed, and we put a real mannequin, and we attached the whole thing, and he was, so yeah, and I mean, we have even some video link to prove it. So this project is also special because we had the VA Dallas Biomed jumping in the project. We have clinical nurse leader like Maria Cello, and we have veterans. We have artists to help us to do the video and everything too. Of course, Dallas Maker like Kevin, and Stephen Carr is the brain of this project, pretty much. It's really him and Darren. And this project is also special because we had Cleveland clinics. So not only we had VA Dallas, we have also Cleveland clinics who jumped in and they say, oh yeah, we're going to help you for that project. So yeah, I wanted to say thank you to Cleveland.
All right, team. We'll love to hear both the passion and how much this work means to you all. So from our point of view, none of this happens without you. So it means the world that we're able to recognize you and give you all this platform. So thanks for what you do, and just continue to fight like hell. All right, home stretch, folks. So the Robert Jesse Award for Excellence in Innovation, we saw the video, recognizes top innovators from the VA health system and presents their achievements in 3 major categories of non-clinical, clinical, and team as part of the Undersecretary for Health's Dr. Robert L. Jesse Award for Excellence in Innovation. The award was established in 2019 to honor Dr. Jesse, who was appointed Principal Deputy Undersecretary for Health in the Department of Affairs on July 4th, 2010. Prior to his appointment, Dr. Jesse had served as the Acting Principal Deputy Undersecretary for Health since March 7th, 2010. He was the Chief Consultant for Medical Surgical Services in the VA's Office of Patient Care Services and served as the National Program Director for Cardiology. He implemented broad reforms in the delivery of specialty, subspecialty, and emergency care that have significantly improved the quality of care provided across the VA health system. This year's nominations were received for non-clinical, clinical, and team our department, which could have been either clinical or non-clinical. The non-clinical award goes to the VHA employee who demonstrates excellence and promotes innovation across the enterprise, either at the VA medical facility level, the VISN level, the Integrated Service Network, or the program office level. The clinical award goes to a current VHA clinician who's developed innovative solutions to delivering patient care, resulting in improved access, quality, continuity of care, or patient outcomes. And finally, the clinical or non-clinical department team award goes to 2 or more individuals who have demonstrated excellence to promote innovation across the enterprise, again, either at the VA level, medical center level, the network level, or the national level. This year, we received a record number of nominations in each award category. I can tell you just from looking at them, the extent of work that's going on across this organization is quite head-spinning. The degree of impact that these projects are having is immense. And it, again, like I said this morning, makes me more confident that despite any challenges we face today, we will solve them. The non-clinical award goes to an individual who has demonstrated not just a commitment to the mission, because the mission means something very deeply to him as an active combat veteran, but also a willingness to challenge the organization's bureaucracy. And I'm saying that as diplomatically as I can. The truth of the matter is that this project and solution is changing how VA cares for veterans, not how it delivers health care, how it meets the mission to care for our nation's veterans. It's tackling one of the most challenging social determinants of health that faces our country, one of the biggest barriers to access to care, and that's transportation. As of today, I believe it has provided nearly 350,000 rides to veterans, getting them to appointments, bringing them home, preventing admissions to the hospital, and demonstrating that VA is there to care for them when they need us. Charles Franklin, where are you? So this year's non-clinical award goes to Charles Franklin. He is an innovation project manager and the VA Rideshare Innovator out of Vision One, New England Center for Innovation for Excellence, NECE for us that have to have acronyms. The Rideshare program began as a pilot with just 10 veterans at the Boston VA Health System in 2018. And since August 2021, and I got the updated numbers today, has facilitated more than 350,000 rides across 2.5 million miles for veterans. Folks, that's an average of 12,000 rides a week, bringing veterans to the VA, keeping them in the system that was built to care for them. Over 105,000 appointments, 20,000 housing service needs, and 15,000 for food. In fact, during the pandemic, when this project faced uncertainty because hospitals closed, outpatient appointments were moved to virtual, Charles didn't blink an eye. He flipped the script and he said, well, there's still veterans that need transportation. Maybe it's not to and from a place, but the home services, the folks that were delivering food and delivering things that we had taken for granted were now out of necessity. And the rideshare program became about delivering those goods and services to them until hospitals and clinics began opening back up. This project now operates nationally to support the VA Homeless Program Office across more than 165 VA medical centers all across the continent. It says 53 states. I don't think we have 53 states, whoever wrote that. So,
And territories.
across all U.S. states and territories, I'll give you the 53. The rideshare program, as we said, pivoted to support more than 70 emergency departments with discharges and 50 VA Medical Center health systems with inpatient discharge, which actually, and quite impressively, uses a platform that leverages AI to help predict who is most vulnerable and who could benefit the most. And so that platform now has integration with over 25 transportation companies. I think the articulation of what you have accomplished speaks for itself. Hard to think of somebody more deserving for this, and your work is truly making a difference, not just in the Boston market, but for the entire country. So both for your service and your continued service, my deepest thanks and congratulations, Charles.
Thank you very much.
Get you the
So-
mic.
I got one on. All right.
Even better.
So first I'd like to say thank you really to the OHIL leadership, the homeless program office leadership, mental health leadership, dialysis, and all those national offices that supported me. Not for your guidance, but for your courage. Understand it probably took a lot of courage on your part to say, yes, Charles, take this and scale it across the entire enterprise on this temporary authority, knowing that we're about to have 20, 40,000 veterans dependent on transportation on your temp authority, but you can do it and make it permanent. So thank you for your trust and really just having the courage to say, yes, Charles, do it. I'd like to say thank you to over 7,000 providers across the VA, innovation specialists, nurses, social workers. You developed this platform. You told me what you needed. We built it for you off your voice. Thank you for engaging with me. Thank you for your time and really putting yourself into this project. Over 7,200 frontline providers across the VA are currently using the platform. And then last, Architecture Solutions. Thank you. ARPAN, you and the customer service support team, project couldn't be without that team. I appreciate your staff's patience. They really take customer service above and beyond. Veteran misses a ride, they're always there to support, make sure they get to where they need to go. So, thank you. Thank you, everyone.
The next award goes to our clinical winner. 2 years ago, this individual started out on a mission to single-handedly improve the ease of use and efficiency of VA clinical computer systems by finding a way to create his own software which runs together with VA computer systems, dramatically increasing the efficiency and reducing the workload required to provide a wide range of computer tasks. As a provider, I can tell you one of the things that frustrates me the most is how much we now sit behind computers documenting, not sitting at the bedside talking to our patients. This solution has greatly improved the speed of physicians and clinicians and nurses across the organization, but it's dramatically reduced some of the monotonous and the tedious and the boring parts that are required in the care delivery experience. He called the product, appropriately, CPRS Booster. And after CPRS, which is VA's electronic medical record system, a survey showed and demonstrated that employees ranging from physicians to pharmacists to nurses, regardless of what clinical profession they were in, rated the project and the solution as the single most useful enhancement to VA computer efficiency. Over 30,000 VA employees across the country use this free software daily. I used it the last time I was on service. It makes an enormous difference in the amount of clicks, how fast I can process. I talked to our primary care providers. Their ability to cycle through patients as they prepare for clinic is significantly improved. And not only the saving the monotonous or erasing the monotonous work that we need to do, but they've continued to improve and add this, and I'm not reading this incorrectly like 53, they are on the 47th version, which can tell you the demand for a solution like this. This software is not just available to VA facilities where this individual works. This was not, as Dr. Clancy mentioned this morning, a symptom of NIH, not invented here. But the goal was to transform the experience for all providers in the system, a recognition that we are one health system. There's also a very intuitive 13-minute video that helps you understand how to use it. And if you know anything about our training, the fact that a 13-minute video actually works, it's pretty impressive. What's even more impressive is that this individual continues to provide technical support to anyone that calls. Is always there to help people use a tool that doesn't provide him any benefit, but makes their lives easier and helps fulfill a little bit more joy back in the practice of medicine. So this year's award for the Robert L. Jesse Excellence in Innovation for Clinical goes to Dr. Adam Bach.
Great. Thank you very much.
We'll pretend. I
Okay.
think they disappeared. Oh, wait.
Oh.
They're coming at all angles now.
It's a lot of photographs. Wow, this is a really impressive award. It's a light bulb, so I feel a little bit like I've won Wimbledon, so I'm going to do this. Thank you. Yeah, I really want to appreciate the VA for giving me this award. It's a very long 2-year project, an endeavor that I've been part of to try to make this happen. It was extremely time-consuming, and moreover, I want to acknowledge the many users of CPRS Booster across the country. They've given me a lot of very positive feedback and a lot of ideas about what to do with it going forward, and that's why we're on version 47 of this. I also want to just take this opportunity to briefly discuss some of the struggles that those providers and those users are having, and that I'm personally having, and that probably many of you in this room are also having, which is that our clinical computer systems are still very annoying and very slow and very tedious. And you know, I don't know about the rest of you, but I feel like blowing up my computer at least twice a week, and I suspect that that's not that uncommon. And so I really would like to use this opportunity to encourage the VA to really focus with laser-like focus on improving our computer systems going forward. You can tell by the fact that this software spread so widely across the VA so quickly from little old Minneapolis to the rest of the country that there's really an insatiable appetite to improve these systems. And so I really want to encourage the VA to continue with this work. I want to acknowledge IT employee extraordinaire Kurt Vernig, who was a co-developer of this. Without Kurt, this product would have started and ended in Minneapolis, but instead it's available to everybody in the country, and that's really solely because of his doing and some risks that he took. And finally, I want to thank the extraordinary management of the Minneapolis VA, including Dr. Arif Ashani, Dr. Kristen Nickel, and Mr. Patrick Kelly, the Medical Center Director. They have provided me with unwavering support and given me a huge amount of job flexibility to work on crazy projects like this. So thank you.
All right, folks, last award. So this one is one that is special to the innovation ecosystem because in some ways I feel like we watched it start from its infancy and now blossom into something that is truly making a difference in the lives of veterans. 2 individuals and really a culture of innovation that for some reason I cannot fathom why everything feels like it's centered in Vision 20, but it is. Developed an innovative care delivery model. Not 3D printing, which seems to emanate from that area as well, but a recognition that there's got to be a better way to provide orthotic and prosthetic care to veterans. And not a better way in saying, you come to us, but what if we went to you? What if we went to your home when it was convenient for you and worked with you in the comfort of your home to provide something that fortunately most of us never have to experience, loss of a limb. And a couple of years ago, as this project was first starting, and still have video images of this, they interviewed a veteran who had been impacted by the mobile prosthetic and orthotic team. And this veteran said something that to me has always resonated and been profound in what these types of innovative solutions mean. That veteran said, the fact that the VA is willing to come to my house and provide this service tells me that the VA truly cares about our veterans and is willing to meet me where I am. That's trust in a system, spoken by the customer because of individuals' willingness to challenge the norm and to find creative ways that are truly innovative to deliver service that traditionally was always delivered in the walls of a hospital. And if you think about why that potentially is, that veteran also commented, because leaving his house with a prosthetic that didn't exactly fit, that was wearing down the area in which the amputation occurred, having people look and stare, caused a great deal of anxiety. And then his other anxiety would take over. And he would get up to the hospital and leave. So without services like this, we can't reach every veteran. And without services like this, we cannot demonstrate that commitment to caring for those individuals. So it is my pleasure to announce the final award to the team that developed the mobile prosthetics and orthotic solution, Eli Kaufman and Daniel Abrahamson. You are.
Thanks, Dimitri. Oh. I'm choked up. I have this thing on the teleprompter that I can't say. Thank you. So, thank you to the leaders who really supported us. You guys are awesome. Came all the way out from Seattle, Dr. Boyd. Really appreciate you. Dr. Beck, who grilled us hard before she allowed us to implement this program. Thanks. We appreciate it. Dr. Highsmith, I know you're on the camera somewhere. Bob Pavolka, who said to me, all right, I'll delay my retirement. Thanks to Dr. Jesse, who inspired us. Really laid the groundwork for innovators. Thanks to Eli. Eli's my friend, my innovator. Thanks.
Aw. Thank you, Danny. At home, my family calls Danny my work wife. And they love him as much as I do. And we have a special thing. It's the team award. I felt it's only right to say aloud and acknowledge the names of the people that have put their blood, sweat, and tears into our work and to help us grow the program. It's kind of a lot, but I think it's important. So here goes. Jeff Heckman, Judy Bowie, Kelly Laura Lewis, Nikki Sanchez, Madison Coffey, Dale Allen, Jared Zinsmeister, Marty Wallace, Peter Fiamalua, Melissa Rome, Kelsey Randolph, Nathan Dooley, Allison Bosler, Molly Russell, Lee Liu, Becca Fagan, Teresa Joyner, Sierra Ware, Abby Shaler, Adam Jacobson, Chad Kincaid. Thank you guys. You guys are the best. Brian Kaiser, Ben Fortson, John LaChance, Carol Gredham, Sonia Rodriguez, Kevin Kenzie, and Herb Nehus. There, in fact, are so many more. I wish I could say all of the names. It's an honor to accept this award on behalf of our program, and thank you all.
Thank you, Dr. Vega, and let me share my congratulations to all of our award winners. I'm honored to work with all of you and so happy to celebrate in your accomplishments and recognition. Incidentally, we do have travel boxes for your awards if you want to get them to my left, your right, before you leave, just so they're easier to travel with. IEX is officially nearing its close. It has been a pleasure and honor to be your host this week. I want to thank our speakers, presenters, and leaders for being with us and leading conversations around the future of veteran healthcare. I also want to thank our event support teams for managing such a successful virtual and in-person event. Allow me to share my appreciation for our attendees, both in-person and virtual, for your engagement, attention, and contributions to IEX. And most importantly, I want to thank our veterans. You teach, drive, and inspire us to do better, be better, and strive for a stronger, more innovative Veterans Health Administration. I want to extend another invitation to our in-person guests to return tomorrow for both the DataX Summit and the VHA Shark Tank competition. Thank you again to everyone, and we will see you again next year.